Our next speaker is Dr. Colonel Sanjay Kumar Mishra. He is a professor and head of Department of Army Hospital Research and Referral, New Delhi. He has a vast experience in this field, though he is a VR surgeon, but he is very fond of cataract, pterygium, and the keratorefractive surgeries. And I'm sure he'll do the justice to all of your queries, especially in terms of double-headed pterygium and where we cannot afford to sacrifice lot of conjunctiva. So over to Colonel Dr. Sanjay Kumar Mishra.
Thank you, Alok, and very warm good afternoon. I shall be presenting on a new technique, which is known as a mini SLET technique, whether basically in primary and recurrent pterygium. So now the basic IC concept is: are we going towards near zero recurrence? Thank you. Basically, histologically, if you see conjunctiva, what is conjunctiva is basically stratified squamous epithelium, and there is fibrosis underneath. This is the other section of the conjunctiva. And what is the current concept is that what is pterygium? Basically, it's a proliferative growth disorders. And how do you say that? Basically, because of etiologically, if you see, there is a P53 oncogene which gets activated by the UV light and hence leads to a proliferation. And what is the behavioral changes? Because of its aggressive nature and response to any anti-cancer treatment. Traditionally, conjunctiva, it is basically pterygium is excised with autograft. This is the gold standard of treatment. But there is a recurrence rate of almost 3.5 to 10%, 10.6%, which has been published by Dr. Alok Sati in International Ophthalmology Journal. What is the evolving concept? Evolving concept is that it is a localized limbal stem cell deficiency which gets activated by the UV light and leads to a pannus formation. Basically, again, what I said, it's if you see the histologically, it looks like a pannus which results following a chemical injury. The other thing which is evolving is formation of Fuchs flex. What are Fuchs flex? They are basically the distorted limbal stem cells which gets migrated in front of the head of the pterygium. And how do you say that? When you see the confocal microscope, you see these Fuchs cells. And when you see, why do you say that it resembles the limbal stem cells? Because of its histology. If you see the nucleus, a large nucleus, and on surface it is coated with P63 protein, which is similar to the limbal stem cells. What is this mini SLET? Mini SLET is mini simple limbal epithelial transplantation. Only one article has been published for routine pterygium surgery. This technique was described in Mexico. Here we have studied the recurrence rate and complications between mini SLET and the standard fibrin glue assisted conjunctival autograft. Basically, we divided into two groups. One group had CAG and other group had mini SLET surgery done, and they were followed at 1 month, 1, 3 and 6 months interval. And the basically outcome was studied as recurrence rate and the complication rates. It was a prospective interventional randomized controlled trial done between 2016 and 2018 at AFMC Pune and Army Hospital R&R. It was consecutive patients with primary nasal pterygium and extension of this nasal pterygium with 2 millimeters into the cornea. And these were the inclusion criteria. And what are the patients which are excluded from the study was that any patient who had ocular surface disorders, a pseudo-pterygium, any hypersensitive to blood content, and positive for HIV and HBsAg. They were divided randomly, they were divided into two groups, which was done by the computer, and a sample size of 40 patients in each group was done. So this is the mini SLET technique. Where after the excision of the pterygium, this is what is the standard which has been described earlier. You place amniotic membrane and you place glue, and over that you place the amniotic membrane. Now the mini SLET, you come to the normal part of the epithelium, conjunctiva. You cut a strip of the limbal piece and divide into 4 smaller pieces. So very small. It's 1 clock of limbal tissue is dissected and cut into 4 parts. And then you take these 4 parts and stick it in front of at the limbal part with the glue. So you have not disturbed the conjunctiva much in this case. So these patients were studied at first day, third day, 1 week, 1 month, 2 month, 4 month, and at the end of 6 months. So what are the primary outcome was the recurrence rate, which was described as any fibrovascular growth that passed out to the cornea across the limbus. And secondary outcome was the operative time, the post-operative symptoms, and other complications. The post-operative symptoms as per the Lim-Bon-Seong 5-point scale was 0 in, that is no symptoms, and 4 with maximum symptoms interfering with usual activities. So 92 eyes were randomized, 10 eyes were lost to follow-up, 42 eyes were in the control group and 40 in the study group. That completed 6 months of study. So we studied as age, gender, laterality, occupation, and preoperative BCVA in both the CAG and the mini-SLET group, and it was statistically not significant. As far as the recurrence rate is concerned, in the CAG group there were 4 recurrence, and in the mini-SLET it was 1, though still it was statistically not very significant. All these patients with recurrence were put to another surgery, that is a repeat surgery with a conjunctival autograft then. As far as operative time was concerned, in the CAG it was 15 minutes, and mini-SLET it was higher, 21 minutes, which is statistically significant. So ocular discomfort like foreign body sensation, lacrimation, pain, and irritation. There was a charting was done with the median foreign body score, median lacrimation score, median irritation score, and median pain score. And in all group, the mini-SLET group scored better than the CAG group. The other complications like graft retraction, graft displacement, subconjunctival hemorrhage, Dellin formation, displacement of limbal pieces, and subamniotic membrane hemorrhage in both the groups were seen in both the groups. So it was not exactly that it was not present in one group. So these are the CAG group which are followed up to 6 months. You can see from the pterygium excision to the almost complete resolution of pterygium. And here in the mini-SLET group, again, it's almost same. If you see the photographs, it's same in both the groups. This is the follow-up of 6 months, head-to-head comparison. The top one is the CAG group, the bottom one is the mini-SLET group. It's same. You can't make out at the end of the 6 months which group underwent what surgery. So basically, current study highlights the positive trend of less recurrence in this study group. In addition, the post-operative symptoms and overall rate of other complications was much less in mini-SLET group. So why there is less of recurrence in the mini-SLET group? Because of the repopulation of the abnormal limbal stem cells with the normal limbal stem cells, and probably because of the anti-inflammatory property of the amniotic membrane. Is post-operative time justifiable in mini-SLET group? Definitely, yes. If you see the rate of recurrence and other complications which are minimized, yes, it is definitely justified. Is it advantageous? It is likely to restore the normal anatomy of limbus, preserves the superior conjunctiva for further surgery in case if the patient requires any glaucoma surgery, and it is higher suitable for patients with limited amount of conjunctiva, which is available, especially like Sjogren's syndromes. What is the uniqueness of this study is that first, it's the first of its kind study which compared the mini-SLET with the gold standard. Second, this study gives a hope for any recurrence-free pterygium surgery in future. Thirdly, the impact of mini-SLET group on less recurrence, and this study further validates involving the pathogenesis of pterygium like UV light induced dysfunction of limbal stem cells. Based on the study, the authors recommend mini-SLET group, mini-SLET technique, which is suitable alternative considering the effectiveness and the less complication rates. However, a multicentric randomized control trial with a larger group is required to further validate the study. Thank you.
A very lucid and very evolving presentation by Colonel Sanjay Mishra. Now we have adequate time. It's totally open to the discussion. I request every one of you to please participate in this. Any point from your side, audience? Amniotic membrane. Yes, sir. Will
Yeah,
I?
yeah. So amniotic membrane we have in mini SLET we have used amniotic membrane. So instead of using a normal conjunctiva, we have used the amniotic membrane on the defect and used a very small strip of conjunctiva, the limbus stent. So this gives a hope that even with a very small, see the size is almost 1 clock hour. So you have just used a very very small strip, divided into 4 different parts and put it on the. So definitely if you see this, it's less invasive, much recovery is also very fast and the patient is also. It works. It works. So we have shown that.
Sir, because I am also involved with sir in this study. See what's the, if you see the amniotic membrane, what with amniotic membrane also you have the recurrence rate, and it is worse than the gold standard. So what this study has added that in addition to the amniotic membrane, which is taking part in, you know, anti-inflammatory properties, fibrinolytic property, another thing which amniotic membrane has, it also these limbal pieces are adding to that and leading to the recurrence less than that of the gold standard. So mini SLET has definitely an advantage as compared to the AMGs.
No. It's just fibrin glue. The amniotic fibrin. That you can make another. You have to again go to the. See this study. What has been published? We have. Yeah.
What is the, then what
There
is
is no harm in using that. There's no harm in using that. It will give you an added benefit. That's all. Provided you are using in the recommended dosage and the duration is proper. So the purpose of using CAG and then SLET, mini SLET is gone. Then you have taken over the conjunctiva. The idea of this study is to use minimal conjunctiva. So if you have taken a CAG, then there is no purpose of using this mini SLET, no, sir. Then you don't require mini SLET. You have used the conjunctiva. That's the gold standard. No, sir. What you are saying is that once you have used conjunctiva, you use the limbal stem cells. No, you don't require further limbal stem cells. So you don't require mini SLET then. I, advantage.
advantage is that we are preserving the conjunctiva.
Conjunctiva is preserved. No,
there are many conditions, ocular conditions, where you have cicatrizing conjunctivitis and other conditions.
Plus,
it is of
in
benefit.
case the patient you require a glaucoma surgery and all, you have preserved the conjunctiva, sir.
And also the patients with double-headed pterygium, as sir rattled out. So they are the advantages.
Yeah, it's
of
a huge advantage in double. So what you're saying is that advantage here, double-headed. I think this should be the concept. One should try this only instead of using large conjunctiva, cutting out almost entire conjunctiva of the patient.
This is a very simple technique. It's just a mindset actually. So since it is a very simple technique, so it can be very well emulated on the ground. Yes, Vijay, you want to say?
The fibrin glue.
It's Baxter,
Baxter.
commonly Baxter.
Baxter, even the Reliance has also come up with this glue. So both are equally good.
Any other point, sir is there to answer? Because this is a topic which is a very, very general topic, and I think we should have a lot of discussion in this.
No, here you don't require up, down. It's just strip because it's a strip which is cut. You can, it's exactly the limbal tissue. So you don't require which side is.
And in addition to what sir has said, I would like to add one thing here. If you have a brownish tinge on one side, that is the limbus. So you can put that side up. brownish tinge.
Even if you miss out on that also,
It
that's
doesn't
still
matter much.
doesn't make any difference. You want to see the procedure again?
Yes, definitely will show.